So I'm Cliff Ledwis. I'm the Acting Executive Director at Access Alliance, and very happy to be participating in the conference today. The various people that were reporting on their research activities, the information is always very helpful in terms of the work that we do at Access Alliance, because it helps to shape the policy that we have, the processes that we look at, the practice that we utilize when we're working with immigrant and refugee communities. We know that some of the research pointed to the systemic barriers that immigrants and refugees face as they come into Canada and go through the settlement process. We know that there are health challenges that they face as they learn about the health system that we have in Canada, and so the research helps to point out some of those barriers in detail, and the things that we can also learn from the research in terms of making changes to how we work with immigrant and refugee communities. So, for example, Mandana Vahabi, who talked about the impact of COVID on the health and well-being of immigrant and refugee communities, as she highlighted, there was a lack of access during the COVID period, so it's important for us to always be open so that the people who need the support, need that care, are always able to access our services. We heard from her that people who were experiencing mental health issues, or people who were suffering from chronic disease, had a lack of access during the COVID period. So it's very, very important that primary care and primary health care remain open and available and accessible to people. We also heard about social prescribing as well, and how important social prescribing is, that people are able to access their social networks. So friends, family, community agencies, those are all part of their social networks, and it's particularly important that those social networks are strong for people who share some of the challenges that they share, so that they can share information back and forth, so that they can be a support network for each other, regardless of what else is going on, so whether there's a pandemic or not. But social networks are key in terms of keeping people healthy, and making sure that their well-being, their mental health, their emotional health, their spiritual health, physical health, are always the best that they can be, so that they don't have to go on to emergency care or hospital care or areas like that.
Just I want to ask you, it may be hard, maybe not hard. Can you identify 5 main problems in the society, like immigrant society or mainstream society, who are not immigrant just few years?
So 5